we're too focused on treatment and we're not focused enough on prevention. So I think right now, perhaps there is evidence to suggest that antidepressant prescriptions are increasing, particularly in younger populations. Perhaps there is a little bit overprescribing, but I think we're not focusing on prevention of these episodes and prevention of recurrence of these episodes once they do happen. We're too focused on treatment and these new fancy drugs with different mechanisms of action when you're tweaking just small receptors and things like this, when we know there are ways to reduce the risk of depression. And I think where there's a little bit of a disconnect is it's a lot easier for us to prescribe an antidepressant. And I think my viewpoint for that is remembering our role as a physician is to inform the person in front of us of what the options are for treatment so that they can make an informed decision. So whether that patient chooses to have an antidepressant, whether they choose to do therapy, whether they choose to do exercise or diet, I think there is still that paternalistic culture in medicine in general, psychiatry included, where sometimes that we feel we know the best option for the person in front of us. But I think we need to remain in this humble position of saying we're educators for the person in front of us. That's what we went to school for, was to learn all these different things so that the patient in front of us can make that decision.